Right now at O'Reilly Auto Parts, get up to a $15 gift card after mail-in rebate when you purchase select Superstart batteries. With the power, performance, and reliability your vehicle demands, Superstart batteries are designed for lasting performance and consistent starts. Turn the key with confidence. Superstart batteries only at O'Reilly Auto Parts.
O'Reilly Auto Parts.
Ladies, we want to meet you where you are. Welcome to the Dare to Ask podcast, episode 9, Breaking the Orthopedic Glass Ceiling.
Well, I'm not the typical doctor story.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
Don't just do this stuff to look good. Do it for yourself. You're bigger than a pair of skinny jeans.
In a very male-dominated field of orthopedic surgery from a female powerhouse in this episode. Hence why it just felt like it was necessary to title it Breaking the Orthopedic Glass Ceiling. Our guest is Dr. Roxanne Keene, and she is one of the only women in the state that does what she does. We're going to get this fresh take on what it's like being a woman in ortho, how important it is to lift other women up into this field. And that is what Roxanne is all about. She's a huge cheerleader for women. And since she is a mom, we get to see her vulnerable side in this convo as well, as she dares to share about how motherhood has made her more compassionate. And what does she do when the evil mom guilt creeps in? We're going to cover this and more. Let's get to it. Football or basketball?
Basketball.
Like watching sports in person or on TV?
Both.
Yes.
Yes.
Are you
I probably would prefer. I would prefer in person, but...
Do you like online shopping, or are you got to touch it and try it on?
I love online shopping. It's a little too much.
I think all of our Visa cards have probably gotten a little more of a workout than ever before.
Yes. No, that's definitely true.
What are your favorite stores to shop at?
Well, Amazon. Mm-hmm. I mean, that covers every need that I have, and
I know.
And more. So
to its detriment sometimes.
Yes.
Like, okay, Amazon, you got to stop being so good.
Yeah. At least ask for a minimum purchase or something, because it's just easy to click.
Are you red or white?
I like red meals and that, but in the summertime, then I switch over to white. Yeah, it's just I like the cooler.
For me, summer or any kind of patio situation, some sort of crisp Moscato, little bit of sweet, but I'm not eating.
Yes.
It totally screws up a meal.
Yep.
Social only, enjoying outside, it's a nice day, that sort of thing. What about coffee? How do you take your coffee?
It has to have some type of creamer or milk in it. I'm not a straight black coffee person. I like the effects of coffee. It makes me a better person. So I have that with a little creamer.
I drink coffee for you, not for me.
Yes, I'm probably that same way.
All right, so let's get down to a couple brass tacks here and talk about what you do every single day, Dr. Keene.
It involves family, transitioning to work, transitioning back to taking care of my family. So
you said family first.
Yeah.
You know, usually when people are asked, what do you do for work? They don't say it's taking care of my family first. Then I work. Then I go back to taking care of family.
Yeah.
That's a testament to the person you are.
Yeah.
I like that.
Thanks.
You definitely do give me women empowerment vibes as an orthopedic surgeon and a woman. It blows my mind that there are so few that actually do this profession across the globe, let alone in North Dakota. What an anomaly you are.
When I started residency in 2006, about 6% of orthopedic surgeons were women. Wow. Now, we have increased to 12% in residencies, but we're just not seeing the numbers grow as far as practicing orthopedic surgeons. So I'm big push on trying to get females interested in the specialty. So I'm a member of the Ruth Jackson Orthopedic Society, which is women in orthopedics, and try to serve as a mentor on committee in there just to kind of get more people interested because you don't get the exposure in medical school to orthopedics, much less being a female. So.
It's interesting because some career paths, women are almost pitted against each other. There's like this competition that I find just so unnecessary. So I love to hear when other females in a career that has nothing to do with mine are about empowering other women and encouraging and coming alongside.
Yeah, because that's the only way you're going to get more people into those, specialties. So,
Absolutely.
Yep.
Which makes me think, what kind of friend are you?
I have a few good friends. I don't have a lot of friends. Just
Quality over quantity?
Yes, definitely. Yep. But the friends I have are long-standing. They've been with me forever. So, yeah.
What would one of your best friends say is your greatest quality?
I think that I probably care and then we have fun. I mean, it's a good balance. When I'm with my friends, I'm a completely different person. I kind of put work and all that aside and we just have fun. But it doesn't happen a lot, so it is nice to, get together with girlfriends.
Well, I just think trying to marriage two worlds here, and that is orthopedic surgery. Your entire professional world is about fixing things.
Right.
So why I asked the friend question is, are you the friend that your friends go to help fix a problem?
I think so. It's always been that way before I became orthopedic surgeon, too. It's just talk it out, give opinions, but in a, not a, this is only it's kind of a back and forth. There are friends that'll say, oh, you help me with this. And I do the same for them. So, but it is kind of a back and forth.
And marriage, you are married?
We met in medical school. I went back to medical school, so I was not a typical med student, and he wasn't either. And so we met in med school and just shared a lot of interest, not just med school. We played basketball all the time, sports, that was just what brought us together. And so I got married in 2007. So we've been married a while now and have 2 daughters. But he's in medicine too, and that really helps, I think. We understand each other and what we're going through. He's not in surgery, but at the same time, he's still...
The demands alone, the pressure.
Yes.
My ignorance is showing for sure when it comes to orthopedics. Are you more of a in and on-call situation, or are you really more of a, here's my 9 to 5? Different practices of medicine are so different.
Yeah, depends on what practice you're in. I recently moved to Fargo about 1.5 years ago, so I'm in a completely different practice. I was in a solo practice before, and then you're kind of at the mercy of what comes in. The next day, they're always there waiting for you. Whereas here, I have partners, so it's really nice we share. So I'm on call sometimes, and then I have kids husband knows when I'm on call. I mean, that's just how it is. We don't plan a lot. But the other days, it's really nice now because when I finish with my day, I'm done, so...
At Essentia, too, it seems like the team approach is taken in so many different fields, and I love that.
Yes. Yep.
Providers are also communicating with their team members and other providers. So, of course, my perspective is I'm just a patient, and I go in and know, well, let's say, Dr. Keene, you're my orthopedic surgeon, but you're on vacation. You're in Europe. You found yourself on a beach. You have a cold Moscato. You're good to go.
Yes.
You're getting a little sun-kissed vitamin D. But that a capable provider is able to step in and help.
Yeah. And I've been lucky because in where I was before, I had a physician assistant that worked with me. And I was very lucky when I moved to Fargo that she chose to come as well. So we've been, a team. So it's like having an extension of myself, and she does a great job. So that's been a huge help when starting a new practice here, too.
And honestly, I like that she's a female.
Yeah. In Williston, where I was before, it was an all-female team. All my nurses were female, all my mid-levels were female, and me. So we had kind of a unique situation up there.
Not all heroes wear capes.
Yeah.
I mean, people, there's stethoscopes and there's coats on. You're on boards. You're in this field. You're a woman. But how did you get here? How in the world? Because if it was 6% when you got into this field of women actually in orthopedics, what turned you on? Young Dr. Roxanne Keene decide orthopedics is the way I'm going.
Well, I'm not the typical doctor story. So when I was in undergrad, I did athletic training. I liked sports part of it. It was just, and it's when I was trying to decide what to do after graduation, it was between grad school, and then I have an aunt who's a nurse practitioner and one who's a PA, and they said, hey, you should look at PA school. Didn't even cross my mind to think of medical school. I said, sure, I'll go to PA school. So I ended up applying to only places that I thought would be fun to go. Well, there's little North Dakota girl ending up in New York City. So, and this is pre-cell phone internet.
Yeah.
There's just me, my suitcase, and New York City.
Oh my goodness. Well, I'm really fascinated. What years did you live there?
So 93 to 95.
Wow.
Yeah.
So pre 9/11.
The bombing of the first bombing of the World Trade Center happened the weekend I was interviewing there. And we had no idea. So here we are, live news crews are doing these, talking about it. And here's my friend and I traipsing past the background. I mean, and we had no idea. We're like, what's everybody doing here? You know, you just didn't think of world events
but
at
then
that
you
time.
knew.
Yes.
And you went home. What did mom and dad say about that?
They were they knew I was more independent than they probably wanted me to be at that time. So they encouraged me. I mean, if that's what I wanted to do, they gave me when I got accepted there, they said, well, if you want to do that, do that. But there were a few phone calls and tears.
I'm sure.
I'm not sure if I did the right thing.
So very similar in that we're Midwestern girls, small rural area. Yep. I moved to Minneapolis. And I mean, my grandma called me once and was so concerned. She said, I was watching the news and I heard 2 men were shot. Grandma, it's a real big place. I mean, that is going to happen.
Yes.
So I can only imagine, especially with New York City, a far greater, ginormous urban area. How was your time there?
Oh, it was fabulous. I got in, once we started classes, I met friends in the class. But, I mean, I wouldn't trade the experiences I had there for anything. You know, I did a rotation at Rikers Island Prison. There's me walking down the hall with, it was just, they'd go in lockdown it was just, eye-opening. I saved all the newspaper clippings because I was like, I was here during this time,
Taking it all in.
Yeah. And so then, I had family come out to visit. My mom and dad came, and I'm like, oh, dear. They loved it. They've gone back multiple times. Here's my dad in his cowboy hat from a town of 500.
Yeah.
That was one of his highlights. But then when I was there, I, knew I didn't want to stay there. And luckily, some of the people I knew it was Merit Care back then, said, hey, why don't you come back and work as an orthopedic PA? Your skills as an athletic trainer kind of help carry over. And so I was lucky to, have a job, came back to Fargo and worked there for a period of time. Yep.
Okay, so you were here then in the late 90s, back in Fargo.
But then went to Minneapolis for 2 years.
Okay.
And then, here I did general ortho. There I worked with a spine surgeon and a hand surgeon. And she was a female. And so she was kind of a really good mentor role model to me. And that's when I started thinking, I wasn't married. I didn't have kids. I was like, wonder if I could be a doctor,
Yes.
So started looking into it a little bit more, decided to move back here. And then when I got back here, I was like, I saw some doctors coming out of residency and they were asking a lot of questions. And I'm like, I can do this. So that's when I decided, I said, apply to UND. If I get in, I get in. If I don't, I'll just follow. And my aunt, again, the one who was a nurse practitioner, she was one who pushed me initially. She said, I'll pay for your MCAT. I'll pay for your MCAT. Just take it. So I said, all right, I'll do it. And then, ended up getting into UND. And I said, oh, I'm not going to be done till I'm 40. And she said, well, aren't you going to turn 40 anyway? That's a good point, So,
oh, the wisest words.
Yeah.
You got into UND. What next?
Continued to work as a PA during medical school. 10 weeks off between your first and second year med school. So I took off to Alaska, Fairbanks at an Army base as a PA again. My aunt lived in Grand Forks. She was awesome. She let me stay in her basement for the 2 years that I was up there. Then we moved to Fargo. So just had a lot of support. And then I met my husband in medical school. First of all, when I started medical school, I was like, I don't want to do ortho. Ortho is very competitive. I knew the time commitments. I'm going to find something else I like.
Were you intimidated that it was such a male-dominant field?
Yeah. I mean, I didn't know. And I thought, I'm going to pick something easier. That I went through everything. And I realized I liked the surgery. I couldn't decide. I'm like, well, what do I do? Where do I apply at? My husband's from Southern Illinois. He's like, oh, I have a classmate from grad school that's in Springfield. You should go do a rotation there. Love the program. Just had a great month there. So I put them at the top of my list. And when match day came, I matched theirs.
What got you back to Fargo and North Dakota in general?
We were married, had a couple kids, and all of a sudden we're really crunched for money. And
Yeah.
so there was a recruiter out of Williston who let her every so often. And one day, I was always like, oh, thanks. I'm not going to Williston. I'm not going back to where I'm from Ray,
Right.
which is nearby there. She said, we can provide you a stipend while you're in residency. And I was like, well, we'll go to Williston for a couple of years maybe.
Yeah.
So interviewed there, thought it'd be nice to be closer to my mom and dad. My brother's in Bismarck, so it was nice to get back. I knew in my third year residency that I was coming back to. Kind of helped me tailor then. I knew I wanted to do general ortho. I liked a little bit about everything, so then ended up kind of being able to do that when I went back to Williston. So
On topic, it's also off topic because I'm really glad that you actually brought up in a roundabout way money. Definitely a misconception for a lot of the general population is that, well, you're a doctor, you make so much money.
Yeah.
That climb, though, from school, the amount of student loans.
yes. Well, by the time you do your undergrad, I had loans from that. I did PA school, had loans from that. Then in medical school, did loans from that. Well, then residency is another 5 years, 80-hour work week. Yeah, so by the time you put this 4 plus 4 plus 5, you're pretty deep into it.
Oh, you're marrying somebody in medicine, too, so
Yes.
he's got the same baggage
Yes.
you got.
Yes.
Because love and marriage and all that, let's have a few kids.
Yes,
Those
yeah.
are cheap. It's fine. Everything's fine.
Yeah,
We're
you don't
fine.
realize daycare costs till you have kids, and then you're like, ooh.
You have been in Fargo now for a year and a half. I love that you have this mission to also encourage and help other women to get into this field. What is it, though, about orthopedic surgery that you love?
I'm kind of this is broke, fix it kind of person. I don't want to try this and then try that. And so, I work with age range from peds to adults. So I like that I get a variety of people. I like that some of my time is in the clinic, some of my time is caring for people in the hospital, and some is in the operating room. So I don't ever get bored or have to see the same people over and over.
Sure.
There's a variety. So I do like that. And then I really enjoy the technical part of being in the operating room.
Now, orthopedics with technology and stuff come a long ways.
Yes. When I first started one of the nurses said, how can you do this? She said, you have to be strong to be in orthopedics. I said, no, you have to be smart to be in orthopedics. You have to use the tools, the right way. There are times where I'm exhausted afterwards, but it's power tools. It's doing the right maneuvers, things like that anybody can do it, Yeah.
You're in it, right?
Yeah, right. Yeah.
The people that I interview on this podcast, we usually get into kind of some myth busting. Now, you said pediatrics because that is not where my brain goes. I think another myth is definitely that an orthopedic surgeon really only works on the elderly. Wrong, right?
Right. And there are orthopedic surgeons that choose to specialize too. Peds, I do more of the fracture work in towing, just basic stuff. But you have the sports injuries, you have any age breaks things. So you have the fracture, even joint replacements and things like that, mid-range, and then hip fractures and some of that stuff that's more common in the elderly. So you get kind of a range, which is what I enjoy.
Do you have particular favorite surgery?
Yeah, my favorite surgery is knee replacement. I really enjoy that. I like the technology that goes with it. Robotics are on the horizon, so I think there's a lot of potential. The outcomes, people get a predictable outcome and seem to do very well, and I like that. Same time, I really like arthroscopy too. I think, the minimally invasive part of it, something that benefits people as well, because I'm old enough where I've seen it done the old way where we'd open it all up and how long it would take people to recover.
Probably one of those fresher myths. Things have changed so dramatically in even a decade. It's amazing. My close hand experience would be my mom, both of her hips replaced, and now, most recently, both of her ankles replaced.
Oh, yep.
Over the last 15 years, it's a dramatic difference between the time range, and of course, those are two totally different surgeries.
Right.
But just that alone, probably about 5 years between hips, and even her scars are different. Like the healing time, all of it. It's just so fascinating.
Well, when I started in the mid-90s, we would keep knee replacements in the hospital for 5, 7. They would be there forever. We're down to, we get most people out overnight, and we've started doing same-day total knee replacements. So people go home the same day. So the recovery time is really changed a lot.
What's the biggest reason?
I think we're using different type of medications to help control the pain. I think the implant designs have changed a little bit. You don't have to make as big an incision, and just allows people to heal a little faster. So,
That's got to be exciting.
Yeah, it is. Yeah.
Just that alone means you're able to help more people.
Right, definitely.
Speaking of helping more people, especially during pandemic, people would probably look at orthopedics as something that falls down on the list. But that's not the case, especially presently with what you're doing. You're seeing patients right now, and you're encouraging patients to be seen right now.
Right. We do the testing. We're safe. We've come a long way, and I don't think there's any reason why people shouldn't postpone surgery at this point.
The waiting and seeing is not necessarily the best course of action.
Definitely, because you end up stiff, you end up, losing motion. I mean, there's a lot of things that can, if you wait too long.
Or just general pain. That was something that I saw from my mom.
Yes.
I mean,
chronic pain wears on you, and it changes, your thoughts and what you do. And
it excites me that as time progresses, we keep just getting better and better at things.
Exactly. Yeah, you really have to keep up because things change very quickly. So,
will you tell me a little bit about your kids?
Yeah, 2 daughters, Zoe and Ava. Zoe is 12 and Ava's 11. Yeah.
Boom, boom.
Yeah, they're 13 months apart. Forgot the rules for a minute, but it turned out very well because they're best and worst friends, but it has been nice to always have a playmate there.
Yeah. So. Tween-agers, kind of. What do you feel about having a teenager here pretty soon?
We have a basketball team that they play on, and so I get to see that range where some 7th graders are fully developed, adult looking, and then my 2 are looking like they're in the elementary school still. So it's really eye-opening to just see more of the teenager, and I'm not apprehensive, but it should.
We say this all the time. Father time is undefeated.
Yeah. I know.
He's coming for us all.
Yes, yeah.
What do you think is the greatest motherhood victory for you?
I think the fact that I have kids. In my 30s, I didn't think I wanted kids. I liked being an aunt. I liked being with my friends' kids, but I didn't know if that was for me. And I think it opens a whole nother side. I'm a much more sensitive person now. I didn't used to cry at movies. I cry at movies now.
You got in touch with that feminine side.
Yes, I did. That did really help. So it just gives you a little more empathy. They bring so much joy. I mean, it's when you get frustrated with what they do, that the good things far outweigh it, and I think that's just so much fun.
It's enriching.
Yeah.
For me, a little bit different. I always thought, yes, I wanted to have kids, but then my husband and I having a brood of children. So for us, it was more the amount of kids. At first, we have 2 older kids, we have 2 younger kids, and more recently, we lost our baby. For us, our family plan ended up being a big family. I started to hang on to the idea of the Grinch. And remember when he finally realized the glory of Christmas? It wasn't that anything else about his heart was like taken over. It's not like your love of golf or basketball had to go down a notch to make room for the kids. Your heart grew.
It's a good way to say it, because I didn't understand that. But there's room for more. And, I see in a lot of these groups that the women who are in orthopedics say, I don't know if I want to go into ortho because I want a family. And I think it's important to know that you can do things and still have a family. And,
yes.
And my kids know maybe I don't spend quite as much time with them because I'm at work. Time we spend together is quality. So I don't consider it bad that they see a female that works. And my story from Williston, when we had just moved there, of course it's an oil boom and there's flares everywhere. We drive past this oil pad that had the flares going, and there was 2 flares, one big one and one little one. And they said, look it's a flare family. I said, who's the dad? And they said, the big one, and the little one's us. And I said, where's the mom flare? She's at work. So I was like, maybe I'm shaking
I
up.
get it. I mean, mom guilt will creep in even in the most heartfelt ways, right? I know. How do you deal with that? Because we all do. I mean, as moms.
Women, we judge each other a lot. My husband's like, she looked at your shoes. Or, I'm looking. I like style. I think, sometimes if you're a stay-at-home mom, you feel bad because you don't work. And if you're a working mom, you feel bad because you don't stay at home. I have a lot of insecurities either way. I don't think it's better that I work. For me, I'm a better person, but that doesn't mean that the person who chooses to stay at home isn't a good person. We just have different things that we want to do. So,
I love that perspective. I hope you feel this way, too. As one of the only women orthopedic surgeons in our entire state. great. You are just giving such a wonderful example to raising daughters. I mean, they're seeing their mom in a field and in the title and still investing in quality time with them.
It took me a long time to get here. And so that's my hope, is that, I was very insecure in high school. And I remember one of my teachers wrote when we had senior books, you have a lot of potential, but you need to be more assertive. It took me a long time to get to the point I am. And I'm hoping that just by them seeing me like this, it won't take them quite as long to realize their potential.
I hope it won't take our kids as long to see their potential.
Yeah.
That's a really good message. I'm going to throw this at you. Wellness nuggets. I think it's so important, our women listeners, to hear from a professional. What do you think as women, more women just need to know or need to hear?
Of course, I've always been sports-minded, but when I got into residency and I didn't have time, I kind of put myself on the back burner. Didn't have kids, I got to play sports, and I was in the best shape of my life in med school because now I'm just playing basketball, and it was fabulous. Well, then when you start residency and have kids, everything else comes first. In 2017, my husband, I'm the bad Peloton commercial from last year. My husband bought me a Peloton back in 2017, before he even knew what Peloton bikes were. He did not say, here's a bike to lose weight. He just had read about them and thought it would be fun. So when the Peloton commercial came out last year, I'm like, oh my God, did you buy me that bike for that reason?
Oh my gosh, I should be offended, but I'm not because I love it.
So I started doing that and then got involved with an online community, PMPG, so Physician Mom Peloton group. And there's 500.
Oh my gosh, how many are those?
There's 500 of us in this group. And so once a year, we go to New York City and we all ride in studio and we all get together. And it's just, we support each other. It's just kind of crazy because you're like, I'm going to New York. Oh, who are you going with? I'm going to meet my friends from the internet. But just being in that Peloton has brought me community, but then it's also brought this whole sense of female empowerment. And all of a sudden I realized when I got the bike that you have to put yourself first too. So that's my wellness point, is that everything else can happen, but you shouldn't put yourself as the last priority. I just think that women are too good at putting everybody else first. And you have to put yourself up there too, because if you don't build your base, everything else is going to go. So you get that physical side, watching my diet, I count my macros. So ended up finally 11 years later, back to my pre-baby weight. You do not have to take pounds off, but that's why I teach my kids. Just work out to be healthy. You add the eating portion in there too, and you just feel better about yourself, which I think helps with your self-esteem.
It's just so all around.
It is.
I mean, from the mental aspect to the physical exertion, how much the body really wants that, needs it, and it's its healthiest self when it is. And yes, the perk can be that the jeans can button now. You feel a little more confident.
You're bigger than a pair of skinny jeans. Don't just do this stuff to look good. Do it for yourself.
Thank you.
Yeah.
You've been a joy to talk to today. And I've got all kinds of little goodies throughout our conversation where I feel like so many people are going to grab something important. Dr. Keene, thank you so much for joining me.
Thank you very much. I appreciate it. Thanks.
You are bigger than a pair of skinny jeans. Wow. That quote is going to stick with me from Dr. Keene. Now, looking ahead to the next episode, I have the privilege of speaking with a doctor in integrative and family medicine, and her attitude and sense of humor, it's going to lift you up. I promise it will when we chat with Dr. Kessler on the next Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Dude, how old are those glasses?
Hello? Do you know how expensive glasses are, even with insurance?
Hello? Haven't you heard of Zenni.com?
Zenni.com offers thousands of frame styles and the same quality lens options you'd get from an optician for 1/10 the price. Zenni.com. Eyewear for everyone. Com. Eyewear for everyone. Com. Eyewear for